Most people tend to assume that lower back pain comes from a slipped or damaged disc. In this video, I'm going to explain why that's not always the case, and I'm going to discuss other common causes of lower back pain. Now, first off, let's just talk about causes of lower back pain. And we'll start with the disc because everybody probably knows about it. Now, this is a simple model of the spine. And as you can see here, we have a vertebral bone sitting on top of another vertebral bone. And in between that, we have a substance called the disc or the intervertebral disc. Now, your disc is a form of cartilage and its primary job is to act as a shock absorber. And your disc can be distinguished slightly. In the center of the disc, we have what's called your nucleus pulposus, which is slightly more jelly-like substance, a bit more like chewing gum. And on the outer rings of it, it's called your annulus fibrosus, which is slightly denser and tougher. Now, sometimes what can happen is that the inner center can push on the outer section of the walls, leading to a disc bulge and sometimes a herniation. Now, when someone has injury to their disc, it's what we refer to as discogenic back pain. Now, usually what we might say is that someone is suffering from discogenic back pain, they'll probably have trouble leaning forward. And that tends to make sense in our own heads because as we lean forward, we're compressing the spine and then putting pressure on this disc. Sometimes that pressure can then put pressure on the nerve roots, which is a sciatic nerve root in most cases, and that can lead to pain down one or two legs. But what we know about discogenic back pain is that it's not as common as we once thought. Some research shows that disc pain makes up for around 5% of lower back pain. Other studies show it might make up for around 40% of lower back pain. And what we know is that some people might actually experience pain leaning backwards or leaning to the side or even twisting. So leaning forwards isn't always the culprit, and it doesn't always predict that someone has discogenic lower back pain. But what I just said about how common it is might actually surprise you. It doesn't always explain why someone has lower back pain. Now, the other common type of lower back pain, especially as we get older, is what's called facet joint irritation. Now, your facet joint are these structures here, which basically sit at the back of the spine, and they prevent too much movement of the vertebral bones on top of each other. They basically block excessive movements and stop the vertebrae from sliding forwards. Now, just between the joint, like in most joints, there's a layer of cartilage which acts as a cushion. And as we get older, we know that this cartilage is going to get a little bit thinner. Now, anecdotally, people with facet joint pain might experience pain when they're leaning back or when they're twisting, which might make sense because as we're leaning back, we're putting pressure on that structure. And as we're rotating, we're closing the gap between the facet joints. And facet joint irritation, if it develops and becomes severe, can lead to what's called stenosis, which basically means that the nerve root which leaves your spine, mainly the sciatic nerve root, can become compressed, and that can lead to pain when we're walking or achiness and dull stiffness in our legs. So if you have facet joint irritation, you can still fix it. So that describes facet joint irritation. Now that just brings me on to the other common cause of lower back pain. And as a physiotherapist, I see this week in and week out. It's soft tissue. Muscles, ligaments, tendons are all sit around the spine, which might surprise a lot of people because when we think back pain, we always think disc or joint. But just think about how common it is to sprain an ankle or how common it is to pull a muscle in our leg. We have muscles around the spine at the same time, and their job is to fundamentally support the spine and support movement as well. So it is prone to injury. Now, it's still very difficult to distinguish whether it is soft tissue related. People might experience pain widespread along the spine. There might be swelling, there might be inflammation, but usually the pain won't refer down the legs. There might be pain in one or multiple directions as we move the spine, but usually people with this type of pain, symptoms do improve quite quickly, usually within a few weeks. And it usually can have a trigger like lifting inappropriately or being sustained in one position for too long. But in my experience, it's far more common than discogenic back pain and facet joint irritation. So there I basically described discogenic back pain, facet joint irritation, and soft tissue pain, all of which we call mechanical lower back pain, and all of which is treatable. If you're someone experiencing discogenic back pain, you might want to check out this video here. If you're someone experiencing sciatica, you might want to check out that video there. Now, if you're also someone experiencing lower back pain and you want 23 ways to improve it quickly, then just check the link in my bio. It's got all the answers that you need.